But we are stepping into summer, right? It's June 2nd, and we need to stay safe. We need to keep our kids safe. So that's why we have Dr. Joseph Finney, who's here with us today, who is an emergency pediatric doctor for us. You're here on behalf of WashU and St. Louis Children's Hospital. Thank you so much for joining us and waking up early this morning.
Absolutely. I'm happy to be here.
Yeah, you know, there's so much to get into, Paul. I mean, I know you've got questions. I do. You are a parent first and foremost, so you have known how sometimes these summer injuries can really pop up and affect us all, right?
Falling out of a tree, a broken arm, you know, fireworks, hopefully not.
Hopefully not.
Yeah, what's your experience been with
I mean, you know, we see a lot of different things. Obviously, we see some minor injuries, things that we can treat in the emergency department and get you home. And then we see more serious injuries that require, you know, inpatient resources and things like that. And I think when it comes to mild injuries, that's exactly what you were talking about, is the kids fall a lot, right? And they have big heads compared to the size of their body. So head injury is a big problem. Concussions, cuts to the forehead, big lacerations. My daughter just the other day fell and hit the table and actually had to get some glue to fix that cut. So it happens even to us. We see falls on scooters, bicycles, trampolines. Trampoline parks keep us in business for sure. Lots of broken bones, those kinds of things. But those are easily treated in the emergency department. Put in a cast, put some stitches in, and those kids can get home and get on their way. The more serious injuries we see obviously require more care. Those tend to be when things are motorized, right? So you've got motorbikes, scooters, go-karts, ATVs, those kinds of things. And those obviously a more significant mechanism, so more potential for harm. And I'd be remiss if I didn't talk at least a little bit about the exposure to gun violence and penetrating trauma or injury due to weapons that we see. This is a really common problem. It's actually one of the leading causes of death in pediatrics. All causes of death is actually related to gun violence. And so, you know, and it's not always people that, you know, are shooting each other, you know, on purpose. It's kids who get exposed to weapons that are unlocked or not safely stored in the home. And there's accidental injuries from these firearms. So we actually at St. Louis Children's Hospital, in partnership with BJC and across all of our healthcare system, offer free gun locks, no questions asked. You can get them in the emergency department and a lot of our outpatient clinics, because safe storage, injury prevention is a really important part of that. So.
Well, this time of year, are you seeing those sort of injuries, those gunshot injuries, ramp up with more kids home from school and walking around the house? Yeah, are you seeing that as well?
We definitely are. Obviously, kids are out, adolescents are out in the community more. There's more opportunity for conflict and things like that. So it definitely is something that we do see more commonly in the summertime. It is a year-long problem, but definitely, and we've seen an increase recently over the last few weeks, increase in gun-related injuries, absolutely. And fireworks, you know, just like you had said earlier, we have seen a lot of those as well.
I probably should have gone to the ER a few times, being a clown with fireworks. What do you see the most from you know, just generally? What do you see the most?
Yeah, I mean, broken bones definitely keep the lights on at the emergency department. We see a lot of broken wrists, a lot of you know, upper arm. Pediatric patients, they are unique, so there's areas that are more likely to break. They fall off the bunk bed. They can break their upper arm, you know, their humerus, or they can break their wrist. Those are pretty common things that we see. I would say dog bites have become more and more common, especially in the summertime. People are getting puppies. That's a big problem that we see. And cuts. I think we do a lot of laceration repairs. That's pretty common as well.
You know, I gotta be honest, when I was growing up, my dad was like, all right, no trampolines. Like that was his way of just, I guess, trying to prevent, and I've never broken a bone, knock on wood. So, I mean, who knows, maybe it works, but do you have any tips for parents to try to avoid these ER visits?
Yeah, it's a great point, because injury prevention is really the key to all of this. That's our focus always, is on making sure that we prevent all these sorts of injuries. So, you know, one is trying to be vigilant. You want to keep an eye on your children. Obviously, we all do our best, but there's no way that you can watch them all the time. So helmets are really important. Keep teaching your children about safety in the street. So they have to look both ways. They need to stay on the sidewalk. You know, those sorts of things are really important. With trampolines, you know, you obviously want them to be as cautious as possible, but you know, it is a trampoline, so there's a certain amount of risk there. You know, one thing I want to say to everybody watching this who has a driver's license is please slow down in residential areas. We see so many children who are hit by cars. It's that, speaking of things that have picked up over the summertime, hit by car encounters has really increased. So it's just, you got to look where you're driving, drive the speed limit in these residential areas. It's really, really important, because kids dart out from behind cars. If they're playing hide and seek, they might be under a car. So you just really have to be aware of your surroundings as an adult.
Oh, man.
Yeah, and you know, you want to go slow because that will change your life. Even if it's not your fault, a kid, that's just terrible.
Yeah,
And
getting there 5 minutes sooner is not worth it.
It's
Yep.
not. That's
stole it.
Paul's favorite thing to say
Yeah.
every morning as people start their day and get going. Every summer I also do a series on swim safety.
Yes.
We're going to have a lot of kids in the water. Do you have any tips for parents out there, and even those kids who may be eager to start swimming but aren't the most proficient swimmers?
Yes,
Any tips?
absolutely. So that's such an important thing, and that's where vigilance becomes really, really important. So, you want to prevent it as much as possible. So if you have a pool, it needs to be surrounded on all four sides by a fence. It can't just be like, you open up your back door to the pool. That's not really good enough. If that is the situation you live in, then you need to have an alarm on your door that when it opens, it sounds. So it's not just a matter that it locks, but it needs to make a sound so that you can hear it. You need to try and, start teaching your kids how to swim very early, but that in itself is not going to be preventative. So it's important to have early swim lessons, but really preventing access to the pool is going to be critical. So it needs to be locked, a 4-foot high fence, no wider than 4 inches apart for each of the pieces of the fence so that they can't get through. And then when you're done with the pool, take everything out of the pool. You don't want it to be enticing for them to go get a toy or something like that might be in the pool.
Floaties.
Absolutely.
Yeah. Oh, yeah.
And the old adage, when everybody's watching the pool, nobody's watching the pool. It needs to be one individual who's not consuming alcohol, whose job it is to watch everyone who's swimming at that time, no matter where you are. Because we see so many drowning events where everyone was watching the pool, right? Well, then nobody really is.
Dr. Finney,
tips.
great question. We don't even have to question if he knows what he's talking about, right?
Yeah.
You don't even have to look. And I know you're one of the few doctors trained in pediatric emergency, so you know it. But let's speak to the crowding of an ER. How do you know when to actually bring your kid in?
Yeah, it's a great point. So I don't know if my institution would want me, saying, nobody's in the ER at this time, so definitely go. When there's an emergency, you come to the emergency department. We do a very good job of trying to what we call triage patients. So the sicker patients are going to get seen first. That's a big concern that people have. Why is so-and-so going ahead of me? It's because there's certain vital sign checks and certain complaints that do get priority because of the chance that those patients are more sick. If you have a broken bone, things like that, that's going to need to be put in a cast, it's really important to get probably to a children's hospital in the first place. We see a lot of times that patients will go to urgent cares first. They'll get an x-ray. Yes, the arm that's bent in the wrong direction is definitely broken, but then they get transferred to our hospital, and it just adds time to their care.
Yeah.
So trying to get there sooner, to the area where you're going to, if you just need to, like a Band-Aid or something like that, or something minor, then sure, you can go anywhere. But if you're going to think you need specialized care from pediatrics, a pediatric hospital is really where you need to go. So getting there in the first place is really important.
Very, very great tips there. Look, we already touched on the fireworks. I know that's going to be, a safety risk as we get closer to 4th of July. Lots of cookouts as well, lots of open flames, grills. What sort of safety tips do you have for our little ones who might be running around enjoying the sunshine outside while you're trying to cook? You got so many things going on, pets.
Yeah. Absolutely. No, it's great points. You need to have a space, right? Because kids, the frontal lobe, their ability to reason is very underdeveloped. So they're not going to think about things the way you do. So you have to create barriers to access to these things, not just saying, don't touch that, it's hot. That's not going to be good enough, right? So if you have a fire pit, then you need to have things around the fire pit that prevent them from getting close. The fire pits that are just, straight down the sides where there's nothing on the outside and it's white hot, right? Those are things you want to put things around it, stones or something like that, that can prevent the kid from getting access. And you want to, put the playing area away from where those things are going to be so that you don't have them running around, playing with toys or something like that right next to where the fire is going to be. So trying to think ahead as much as you can. Okay, this is a potential risk. How are we going to maybe avoid that?
So good.
Wow.
And life-saving information is things that you do not think about every day. And as parents, you have so much going on anyway.
Yeah.
You're just trying to make sure that everybody has a fun summer, but most importantly, a safe summer.
Absolutely.
So we really thank you, Dr. Finney, for coming in. Those were life-saving tips you just gave.
Absolutely. Happy to be here.
Absolutely.
Thank you so much for waking up early with us.